So it says, Gail Savoie, how far should you squat after meniscus surgery? Great question. It says, I'm wondering if squatting too low with knees in a good position is a problem for this injury. My range of motion was fantastic, never an issue prior to this injury surgery. You know, I'm wondering how safe to get back to squatting. So the question is, you know, did they do a cleanup? You've got a physical therapist. Relate to that physical therapist. Talk to your physician about when they're progressing. So if it's a meniscus cleanup, you know, theoretically it's about getting the swelling out and letting the surgery portals heal before you go ahead and come back into the knee and managing the swelling in the joint. What we can tell you is that the thing to look at when you're bring the joint back online is that if you have a swollen joint at all, and remember, even just a tablespoon of fluid in the joint can really disrupt joint kinematics, is that we want to make sure that you're looking at the ankle, and that if your ankle is not in the middle of your foot when you squat, we've referenced this a lot, then you're not in a good position. If your weight isn't balanced between heel to toe, you're not in a good position. So what we want to do is if you look down and squat and the ankle collapses, it doesn't matter how far you turn your knee out or how far the foot is turned out, but if you're keeping that joint centrated over the ankle, you're going to be centrated at the knee. That means you're going to have forces balanced. If the more the foot turns out, the more likely you are to capture that posterior horn on the meniscus and irritate. That's one of the mechanisms for posterior meniscus tear. If you're looking at the femur relative to the leg and the foot turns out and the femur translates, oftentimes that femur is translating across the grain of that meniscus, the ovoid meniscus and semicircle meniscus. So it's important that we're looking at the ankle to normalize joint forces laterally, medially, and the easiest way is to do that. Weight forward to back keeps hamstrings and quads in good balance. And the only change then is where is the weight? I'm keeping my torso upright. You're going to see a lot more knees forward. Can torso come forward a la back squat and Mark Ripito? Then it's okay to let torso come forward, but the weight on the foot is going to remain balanced. So if you find yourself out of plane, then you're going to be smoking your knees and you're not going to be stable, and that's going to create a lot of shear. So, you know, got to look at the weight and balance. And if your ankles are collapsing while you're squatting, I would use this is my guide to coming back. We always, when we're ever coming back from injury or surgery, we start with a very simple template. First things first, do you have good isometric control? And can you start to develop tempo through trained range of motion, right? Can you then simply add basic linear progression? So you get the Squat Every Day award, congratulations. And the last thing that we'll add is speed. We'll add load before we add speed. So slow things down, give yourself a chance to reclaim that in your brain.